Hello, good evening, and welcome back to Doodles MD, where you get simplified medical information in relatable and applicable format. I am your host, Falake Lawal, public health and double board certified infectious diseases internal medicine physician. I'm back this week talking about pharyngitis. But before we start, please make sure you subscribe to our channel so that you can get notifications when we have new information. Stay tuned. Talking about pharyngitis, first question is, what is pharyngitis? It's commonly known as sore throat. And this is pain or irritation in the throat, which is kind of like, middle of the neck or back of the mouth where we swallow. And it can happen either while you're swallowing or just when you're not doing anything, your throat is painful. In many situations, it's accompanied by, flu, cold symptoms. Common cause of pharyngitis or sore throat is a viral infection. 50 to 80% is caused by viral infection, and this usually comes in form of a cold, flu-like symptoms. You're having upper respiratory tract symptoms, runny nose, stuffy nose, coughing, irritation, and that sore throat. Many of the viruses are common ones that we know: rhinovirus, influenza, common cold, coronavirus, parainfluenza. We know all of this. Uncommonly, you can have viruses like Epstein-Barr virus. You can have herpes virus cause sore throat. Acute HIV in some people can present like a cold-like symptom and sore throat. It does present in multiple ways, but that's one of the ways. And Coxsackie virus is one cause, which causes hand, foot, and mouth disease in kids. Viral part of it tends to be more a bit mild and moderate. You tend to have more severe infection with bacterial infection, more severe pharyngitis or sore throat with bacterial infection. Sometimes this may result after you've had a viral infection. We call it superimposed or secondary bacterial infection. And this is because the viral infection kind of weakened the immune system, took away some barriers in that area and made it easy for bacteria to take advantage and cause an infection in that case. The most common bacterial cause of throat infection is strep throat, and that's why it's labeled strep throat. It's caused by streptococcus bacteria. It's less common, and in this case, you have a myriad of symptoms, which I will talk about in a bit. Other less common causes that can cause pharyngitis, which is irritation of the back of the throat, is allergies. It can be trauma. It can be cancer. Cancer therapy also. Acid reflux is one common cause that many people have. It unfortunately may also be a part of something more serious. So you could have things like a peritonsillar abscess, which is your tonsils. Around your tonsils, you have an infection. There's an abscess there that can extend a little bit and cause inflammation of the pharynx. You can have a retropharyngeal abscess, which is pharynx, which is basically the back of that same area. You have an abscess there and it just extends a little to the front, causing inflammation of the pharynx, which is in front. Epiglottitis is another infection. The area is, small, it's closely packed, so one part can extend and cause problems in another area. So I was talking about signs and symptoms. So for the sore throat itself, what do you feel? You feel dry, scratchy throat, right? And then you can have pain when swallowing, pain when speaking, and many times pain when you're not doing anything. Your throat just hurts all the time. You may also have like a fever, a headache, joint ache, muscle ache, and swollen nodes in the neck. The headache, joints, body ache, and all of that, those are generalized symptoms, and those tend to signify either you have a viral infection, because they tend to have a systemic effect sometimes, or a serious bacterial infection. And the swelling of the lymph nodes just show, localized infection, because the inflammation is draining to the lymph nodes in that area. When you see a health professional or a doctor, or sometimes you have someone in the, in your house who takes a look at your throat. They could see that the back of your throat is red. It could be swollen, and also there could be exudates, which is like whitish or creamish stuff on the back of your throat. About strep throat, in talking about the diagnosis, because it's very important to be able to differentiate it early from viral than bacterial, because the bacterial, the strep throat can have serious complications. So there is a criteria that we tend to use that gives a quick way to be able to say, oh, this is very likely strep, or this is less likely strep. And you check for 4 symptoms. One is, does the person have a fever? Usually, of course, in children, but adults too have it. Does the person have a fever above 38.5 degrees Celsius? Is the throat, when you look at it, is it swollen? Do you have swollen or tender anterior cervical lymph nodes? So the front of the neck, beneath the jaw, in front of your neck, right here, right beside your throat. Is there swelling of lymph nodes, and are they painful? So those are, that's 2 signs, right? Fever, the lymph nodes, are they swollen? Are they painful? 3rd sign is tonsillar exudate. So when you look in the back of the throat, do you see that whitish covering, or cream color or gray color, depending? Do you see an exudate? 4th is, does the person have a cough, right? If any of these first 3 is present and you do not have a cough, no cough, it's very likely or more likely that you have a strep throat infection, which means that when you have a cough with your sore throat, it is less likely to be strep throat. But of course, if you have 3 and you still have a cough, the chances are still high. So the guideline for trying to manage it is going from 0 to 1 or -1 to a +1 sign. They generally don't treat with antibiotics because you have a less than 10% chance that it is a strep throat. If you have 2 to 3 of these signs positive, then you want to have a test done, either a throat culture or a rapid antigen test of strep throat. We call it strep antigen, rapid strep antigen test, where they take a swab and quickly diagnose, and that comes out in about 30 minutes. So those 2 are done, and then there's empiric antibiotic treatment with probably penicillins, amoxicillin, and stuff like that, to empirically start treating early. And if the culture comes back negative, you can stop the antibiotics early, and things like that. So that is just very particular about strep throat. Another thing about strep throat, what makes it more important, is that we talk about prognosis and what could happen because you have a strep throat and because you did not treat it on time or properly. One, uncommonly, you can have formation of an abscess. We call it suppurative, a suppurative process. And the abscess could be a peritonsillar abscess. So around your tonsils, you can form an abscess. Behind your throat, you can form an abscess, and that's a retro behind pharyngeal abscess. You can have inflammation of the cervical lymph nodes that we talked about, so they could get infected, right? Infection of those lymph nodes themselves. The infection can spread to your mastoid. So we'll talk about sinusitis. In the sinuses, there's a mastoid air cells, and it can spread basically from your throat through your ears into the sinuses behind your ears. And also you can have other infections in or around the throat. And you could have a systemic, infection. Some people can have really bad systemic infections from that. So those are suppurative complications that you could have from just having a strep throat infection. Non-suppurative, which means non-abscess forming, are immunologic related. And this results, you have basically your body, you get that infection, your body senses a part of that bacteria as if it tries to fight that bacteria. While it's fighting that bacteria, it senses certain parts of your body that it thinks it looks like the bacteria, and it attacks it. Really, that's what happens. So it's an immunologic reaction. Your immune system is kind of like just acting and it's not because it's not the infection directly, it is just a affiliated complication. Something that is reacting to that infection is just going a little haywire. And this causes rheumatic fever and results in rheumatic heart disease. And that's why the mention about developing countries is significant, because we still have high rates of rheumatic fever and rheumatic heart disease in those areas. Also is post-streptococcal glomerulonephritis. What you just need to know is the neph there, which is kidneys. So there can be kidney damage from reaction to strep throat infection. So two things, if you don't take anything away, is that if you don't treat strep properly, rarely people could have abscesses in the throat. An abscess is a collection of pus in this tight area. It's around the neck, it can go to the brain, it can go down to the chest. It's really bad, and it can choke people, right? So people can choke, close off the airway, you can't breathe. Two is you can have heart damage, kidney damage from result of having strep throat. So that makes it very important. So how do we manage strep throat? At home, if it's more likely that you're having a viral infection, you just want to hydrate. Hydration is very important. So hydrate, drink as much liquids as you can. Of course, your throat hurts. So gargling with warm salt water helps also in a way to disinfect the area, and it just has some soothing feeling that people get. Another is like numbing lozenges like Cepacol and things like that. They can help to reduce the pain because they have lidocaine, local anesthetic inside it, and it numbs that. So you could like take a lozenge and use that the 2-hour or 3-hour window to drink as much water as you need, or eat to be able to swallow and keep things down. If you're having a fever, joint pain, body pain, headaches, you can take ibuprofen, you can take acetaminophen or paracetamol, naproxen, something in that area. Please, please, please avoid aspirin. Do not take aspirin when you're having like upper respiratory tract infections, because depending on the type of virus you're having, it could cause another problem in children. So you can take NSAIDs, you can take Tylenol, paracetamol, but avoid aspirin. So I'm going to put a pin on that. That is all for pharyngitis this week. Thank you for tuning in. Thank you for staying with us. Please share your thoughts and questions on this episode. Next episode, we're going to talk about laryngitis, which is inflammation of the voice box. Share this video with your friends, follow us on our social media handles, and make sure you've subscribed to our channel. Till next time, I'm Folake Lawal, signing out on Doodles MD.